In this video, we'll be reviewing brain tumors by critically thinking through 5 brain tumor questions. I will read the question for those listening to the video, then pause to give you a second to try to think of your own answer. Then I will read the options. After telling you which option is correct, we will have a short discussion. This is just a surface review. If you'd like more in-depth information about brain tumors, you can find that in your nursing resources, usually under the neurological or immunological cancer sections. Let's get started. Question number 1. The nurse is assessing a client with a possible diagnosis of a brain tumor. The nurse expects the client to present with first choice, headache in the evening. Number 2, tachycardia. Number 3, continuous vomiting, and number 4, headache in the morning. The answer is number 4, headache in the morning. The thought should have been that headaches, especially in the morning from increases in intracranial pressure, are common in brain tumors. The client may also rise and have some vomiting, but it shouldn't be continuous. If you had a hard time with this question, make sure that you review your brain tumor signs and symptoms. Question number 2. A patient is diagnosed with a malignant temporal lobe tumor. The nurse knows this tumor may present with Is it number 1, changes in temperature, number 2, problems with gait, number 3, problems remembering and expressive aphasia, and number 4, changes in vision and hearing? The answer is number 3. The temporal lobe is responsible for speech and memory. Therefore, the client may have difficulty speaking and understanding language, which is considered aphasias, or short and long-term memory problems. If you had a hard time with this question, it's a good idea to review the different brain lobes with their accompanying symptoms, as this may be an additional presentation when discussing brain tumors. Question number 3. A client with a pituitary tumor is admitted complaining of dizziness and lightheadedness. What should the nurse do next? Should you, number 1, start IV fluids as ordered? Number 2, check the client's ADH level. ADH stands for antidiuretic hormone. Number 3, assess the client's blood pressure. Number 4, sit the client down and check for PERLA. PERLA stands for pupils equal, round, reactive to light, and accommodating. The answer is number 3. In this question, the client is complaining of dizziness and lightheadedness, and is asking us what we should do. We need to remember that what should be done is to follow the nursing process, and the clinical judgment model starts with assessment. In regards to the dizziness and lightheadedness, the best assessment to do would be to check the blood pressure, which also correlates with the pituitary tumor, which is known for expressing ADH, which has an influence on fluid balance. If you had issues with this question, remember that every time a client complains, you should know the proper assessments to make first. Number 4. A patient has a brain tumor that is determined to be benign. The patient is concerned and is asking if she will need to have chemotherapy and surgery. What is the nurse's best response? Is it to, number 1, say, "You sound concerned. A benign tumor is not spreading. You only have to intervene if the symptoms become debilitating." Number 2, "I am sorry you have cancer. You will need to start chemotherapy and have surgery as soon as possible." Number 3, "What is concerning you?" Or number 4, "Is there someone you can talk to? I can see if there is a group therapy you can join." The answer is number 1. You sound concerned. A benign tumor is not spreading. You will only have to intervene if the symptoms become debilitating. The thought here should have been that she is expressing the wrong information about a benign tumor. And sometimes we have to make sure we catch that in the questions. Not everything the question says is true. The other thing we have to be concerned about is how to best respond. Our response should be therapeutic, as well as make a decision whether we're still assessing or intervening. And in this case, because we know why she's concerned, we're going to go ahead and choose to intervene and teach her the difference between a benign and malignant tumor. If you had trouble with this question, it's a good idea to study the differences in the brain tumors. There's 3 different types: benign, malignant, and metastatic. The benign tumor is the brain tumor that's an overgrowth of normal cells. It doesn't always need to have aggressive treatment. In fact, a lot of times the treatment is more conservative. And surgery may only be done if the patient starts complaining of symptoms due to the tumor, such as vision issues, hearing, gait, headaches. The other ones, the malignant and the metastatic tumors, are cancer, and those need to be treated more aggressively. Number 5. A client is complaining of multiple symptoms post-craniotomy and removal of an occipital brain tumor. Which symptom would most concern the nurse? Is it number 1, headache, number 2, projectile vomiting, number 3, nausea, or number 4, fatigue? The answer is number 2. The thought should have been that physical symptoms that can be fatal are most concerning. And post the craniotomy, the nurse should be worried about bleeding, infection, and increased intracranial pressure. Projectile vomiting is a sign that the ICP is getting worse. Make sure to always know the most fatal symptoms of the diseases you're learning. In this case, ICP. Thanks for joining me in this quick review of brain tumors, critically thinking and learning through questions. If you like this content, like our channel, or find us at sinestrategies.com.